Dünya pandemide 2 yılı geride bıraktı. Şu sıralar en çok konuşulan konuysa Omicron. Bu yeni varyant hakkında hala çok fazla bilinmeyen olsa da acaba pandemiyi bitirebilecek varyant olabilir mi sorusuna yanıt aranıyor.
Well, we clearly need to focus on the hospitalization rate and how many people are becoming severely ill. There's a very clear decoupling between cases at this point and hospitalizations and ICU admissions. This does appear to be a milder strain of coronavirus, and we also have a lot of immunity in the population. I think places that have been hard hit early, like the Mid-Atlantic, the Northeast, New England, Florida, parts of the Pacific Northwest, may be 2 weeks away from peaking, but the rest of the country probably faces a hard month ahead of us. I don't think you're going to start to see a national peak until we get into February, because there's parts of the country that really haven't been hard hit by Omicron yet, and the virus will spread around the country. There's a very clear, as I said, decoupling between cases and hospitalizations, and it does appear now, based on a lot of experimental evidence that we've gotten just in the last 2 weeks, that this is a milder form of the coronavirus.
Doktor Gottlieb'e göre özellikle küçük çocuklar tehlike altında.
It appears to be more of an upper airway disease and a lower airway disease. That's good for most Americans. The one group that may be a problem for is very young children, toddlers, who have trouble with upper airway infections. And you're in fact seeing more croup-like infections and bronchiolitis in New York City among children. So that could be a challenge for young kids, and we are seeing rising hospitalizations among that pediatric segment.
İnsanlar bugüne kadar maske, mesafe gibi önlemlerle kendilerini virüse karşı korumaya çalıştı. Peki bu son varyantta maskeler ne kadar etkili?
Cloth masks aren't going to provide a lot of protection. That's the bottom line. This is an airborne illness. We now understand that. And a cloth mask is not going to protect you from a virus that spreads through airborne transmission. It could protect better through droplet transmission, something like the flu, but not something like this coronavirus. We have to recognize this has not been a benign disease in young children. There's a perception that young children haven't been hit hard to date from coronavirus. That's just not true. We've recorded more than 600 pediatric deaths from COVID over the last 2 years. To put that in perspective, we had 1 death from flu in the pediatric population last year, and so far 2 this year.
Koronavirüsün Omicron varyantını ilk keşfeden Güney Afrika merkezli virolog Wolfgang Preiser de DW'ye verdiği demeçte Omicron'un son derece bulaşıcı doğası konusunda uyardı.
I'm cautiously optimistic that maybe Omicron is a bit less virulent than the previous strains, but we are still seeing patients dying from it. So, you know, it's not a question of a common cold virus yet. It may be moving into that direction, and that would be good news. But the bad news is that, and I like what was said in France in your report, that with this variant, it will be next to impossible to escape infection. We have seen how fast it spreads and how fast the numbers rise. Many patients are also, many infected people are asymptomatic, so not necessarily recognized, but can still pass it on. So I would say that over the next few months, the majority of the population will get it.
Preiser'a göre aşılar ağır hasta olmaktan korusa da virüsü kapma ya da bulaştırmaktan korumuyor.
We know that Omicron is very good at causing breakthrough and reinfections. So having had it or having been vaccinated will not protect from becoming infected and also from becoming infectious, but it will protect from becoming severely ill. And that is what we are seeing in our hospitals. We are getting patients, of course, with severe disease due to Omicron, but those are the people who have not been vaccinated.
Preiser, Omicron'un ilk tespit edildiği Güney Afrika'da son haftalarda vaka sayısı ve hastaneye yatışlarda önemli ölçüde azalma görüldüğünü söyledi. Peki ilerisi için beklentiler neler?
But I don't think the picture is going to change drastically. And luckily, our hospitalization rate has been lagging behind significantly. So we see far fewer severe cases needing hospital treatment than in the previous waves. And of course, the reason here in South Africa is that the majority of people have had COVID during the pandemic over the past almost 2 years. And in addition, we have just short of half the adult population having had the vaccine as well.
Fransa, Omikron vakalarının en hızlı arttığı ülkelerin başında geliyor. Fransa'da günlük vaka sayısı son birkaç gündür 200 binlerin üzerinde.
Ça va continuer à augmenter dans les prochains jours, oui. La circulation du Omicron est très élevée. Si vous regardez d'ailleurs Elle est très élevée sur toute la planète. C'est intéressant, hein, du Burundi au Canada en passant par l'Australie, évidemment l'Europe occidentale. On n'a jamais enregistré autant de contaminations de par le monde, on le savait. C'est une confirmation que ce variant Omicron est plus dangereux.
Donc on va avoir 300 000, 400 000 cas, il faut se préparer dans les prochains jours à avoir ça comme annonce quotidienne.
On est déjà au-dessus de 200 000 cas diagnostiqués, c'est-à-dire peut-être un demi-million de contaminations quotidiennes en réalité, ce qui est déjà un niveau jamais atteint.
Fransız bakan yayılım açısından tehlikeli olsa da virüsün etkisinin daha hafif olduğunu söylüyor.
D'abord, la menace, le risque encouru avec Omicron, c'est un risque d'abord de saturation de nos hôpitaux, des lits d'hospitalisation conventionnels. Omicron est moins dangereux, ça se confirme. Il provoque donc moins de syndrome de détresse respiratoire aiguë et les besoins en lit de réanimation sont moins importants qu'avec les variants précédents. Par contre, il peut, pardonnez-moi pour l'expression, clouer au lit des personnes fragiles avec une très forte fièvre, une très forte toux. Il a des besoins en oxygène de 3-4 jours et donc on s'attend à avoir un afflux très important de malades dans les lits d'hospitalisation conventionnels.
Bakan Veran'a göre aşılama gripte olduğu gibi rutine dönüşebilir. Peki 4. aşı konusunda Fransa neler planlıyor?
Si on a un vaccin qui est sûr, qui est efficace et qui devait nous protéger dans la durée de vagues mortelles, paralysantes pour notre pays comme celles que nous avons connues, nous prendrions, hélas, pour celles et ceux, et je l'entends bien, qui n'aiment pas se faire vacciner, cette habitude d'avoir des rappels de temps en temps. Je rappelle que la grippe, c'est 12 millions là, de Français qui sont vaccinés comme tous les ans contre la grippe. On s'est habitué à ce que les personnes fragiles se vaccinent.
Oui.
Peut-être que nous aurons à vacciner les personnes fragiles contre le Covid.
Öte yandan virüs hızla yayılmaya devam ederken sertleştirilen Covid önlemlerine karşı Avrupa'nın pek çok ülkesinde protesto gösterileri düzenleniyor. Hafta sonu Hollanda'da düzenlenen gösterilerde polisle göstericiler arasında çatışmalar yaşandı.
The problem here in the Netherlands is that we don't have enough capacity in the hospitals for the people, so raise that up. And I know it's not a thing that can be erased in 2 or 3 months, but we don't do anything about it. So maybe we should solve that problem and not put everybody inside the houses, make them unhappy, because unhappy people get sick.
Göstericiler hükümetimiz bize yalan söylüyor, cesaret göstermeliyiz gibi afişler taşıdı.
Maatregelen hebben niks met mijn gezondheid te maken. Er zijn mensen die willen controle. Al mijn vrijheden afpakken. Dus ik ben hier omdat wij allemaal gewoon vrij mogen zijn.